Thank you very much for inviting me today to speak with you about what I have seen in regards to COVID, and thank you for a great question. I have heard this question many times, and I've heard it from many people. I've heard it from patients, I heard it from nurses, I heard it from doctors, and everybody wants to get my take and my opinion. This is Dr. Rafai. I work in an intensive care unit, I work in dialysis units, I see patients with COVID, I see patients who are sick, and I see patients in the clinic. So I have lived the pandemic from day one as a provider, and I can tell you what is my opinion about what's happening. So the main question that I've been asked all the time, what do I think about the pandemic? The numbers are down, the statistics are down, the mortality is down, hospitalization is down. So that means the pandemic is over. What do I think about that question? And unequivocally, without a shadow of a doubt, my answer is absolutely not. It is not over. The pandemic is not over. The pandemic is still here. But what I can tell with certainty, that the nature of the pandemic is different. The rate of the infection is different, and the mortality is different. And I'm going to tell you why here in a second in a very systematic analysis to explain to you why the pandemic is different. The most important reason, which is number one reason why the pandemic is different, is the following. If you look at us as humans behaving at the beginning of the pandemic in January, February, and March, and even April, looking at them in the United States, in Italy, in Spain, in China, and different places, we really had no idea what this was all about. We had zero social distancing, and we had almost zero behavioral changes. But over the past 6 months, now we are in month 9, and for a period of 8 months, we really practiced what is social distancing in pandemic. So we have had distancing, big gatherings are gone, people are no longer getting together and getting close to each other. If you go to any store, any shop, there are these plastic or glass visors that separate. People are using different material to separate each other. Everybody's using gloves, and they're distancing themselves at checkouts, in stores, in check-ins, in universities, in government buildings. There's no longer this crowdedness. Also, a lot of people are wearing masks. And almost universally at the beginning, everybody was wearing masks, and there is no question that had made an impact. A lot of impact, a little bit of impact, that's a point of debate. But without a doubt, masks made an impact. Of course, hand washing has become the norm. Hand hygiene and these things have become the norm. And also people, because they're wearing masks, and some of them wore gloves, they made them aware not to touch your face. On average, each one of us touched their face more than 20 times an hour. So in reality, we were touching our face. Now we have gloves, we have masks, our hands, we are aware and we're nervous, so no longer touching our face. So these 4 elements of social distancing had an impact on the rate of infection for the pandemic. So when I mentioned at the beginning that the pandemic rate is different, is because of these, number one, these social responsible activities that we have conducted during the past 8 months. The second important factor that changed the nature of the pandemic is actually we as healthcare providers have had 8 months worth of understanding of this new disease. I personally lectured in March and April about how it is a medical mistake to give people steroids who have COVID. 2 months later, not 2 years, not 6 months, 2 months later, the National Health Service in the United Kingdom came up with a very large study that really utilized steroids and mainly Decadron when somebody had pulmonary symptoms, and it saved lives. So in a period of 6 months, our understanding of the disease were different. We now use steroids under protocols and understand that it made a difference. We now use blood thinners, knowing from the Italian studies that a lot of people had blood clots in their legs and in their lungs. So our understanding of blood thinners is now totally different and liberal. there is a revolutionary treatment called convalescent plasma that is almost unprecedented type of therapy in the history of mankind for the treatment of any diseases that are viral infectious diseases. We have medications called remdesivir. The issue of hydroxychloroquine was put to sleep. We use azithromax and we use vitamin D. Again, we use vitamin D and we use vitamin C and we use and zinc that help immunity. So now in the past 6 months, that disease that was absolutely unknown to the medical community, we had plenty of time to understand it and institute therapies that really make a difference in hospitalization and mortality. So yes, the pandemic is there. The disease is not as deadly today as it was 6 or 8 months ago because we understand it. We have many therapies and we can make a difference once people get admitted to the hospital. The third and an important factor that should not be ignored is the fact that at the beginning of the pandemic, both patients got sick and society got sick. And because we did not understand the disease, healthcare providers got sick. If you look at the Italian experience, they needed ventilators, they needed doctors, they needed nurses. Same in Spain and same in China. And China being so big, they were able to import doctors from different parts of China to the area that was quarantined, so they had medical staff to treat those patients. Now, why is that important? Because now, today, we look back and we say in the past 6 months, there was some statistics that mentioned about 30 to 40% of COVID patients and corona cases were generated from the hospital. Doctors, nurses, respiratory therapists, technicians, x-ray technicians, lab technicians, unit secretaries, housekeeping, everybody who was involved in the healthcare system got exposed and got sick. So today, the healthcare force that was sick as patients and really made a vacuum in providing care for those patients now has gotten sick and have recovered. So any new patients come with COVID, you would have an army of nursing staff, physicians, respiratory therapists that have had the virus, and they can operate to help that patient with impunity. So in reality, we have now healthcare army that is now immune to that disease. And that in by itself can make a difference on mortality. And there was a joke that circulated on the internet at one time that do you want to be intubated means that if you want to be put on life support and on a ventilator by a gynecologist. With all respect to my colleagues, the gynecologists, but that was a joke. The reason is there were no doctors. Doctors were getting sick, and the only ones that were left are the gynecologists. So in reality, that is no longer a joke because all the ICU doctors that I know about 10 of them, all of them have gotten sick and recovered. Kidney specialists, including myself, have gotten sick and recovered, and so forth. So the workforce that takes care of COVID patients now is COVID immune, which is totally different than 6 months ago. And that makes a difference in outcomes, in how patients are cared for in the hospital, and whether anybody's going to get sick because of lack of expert healthcare. Now we have expert healthcare that are immune to COVID so that you will be fine. Last but not least, you hear the term the herd immunity. The herd immunity is a definition by healthcare officials and epidemiologists and CDC, where they put a number, arbitrary number, that they say 60%, if you have 60% of the community is sick, then nobody would get sick because the virus cannot transmit from one to the other because everybody is immune. And that 60% number really is a convenience number. So today, with as much COVID as we had in areas where they're already gone through the first wave, so we may not have reached the 60% or the herd immunity that the CDC and the healthcare officials are talking about, but we have reached a number that may be also a factor in curbing the spread of the virus. So if you are not immune and you sit among 10 people and 5 of them have had COVID and are immune to it, so the odds of you catching the virus is way less than if you were sitting with 10 people that all of them may have the virus. So why is that important? So the reason it is important, I told you 5 out of 10, which is 50%, which is not defined as what meets the criteria for the CDC as herd immunity, but that is herd immunity -1. So you may not have met the actual official medical definition, but if you're at 59%, you're still almost there. So there is an effect in curbing the rate of infection and the rate of this pandemic. So the pandemic is not gone, but it is not as infectious regarding the rate of infection in our community. So the question comes up, what do we do at this time? In January and February, it was a social responsibility. Every person in the society had a civic responsibility and had a social responsibility towards everybody else to reduce the rate of infection and the rate of transmission and protect the vulnerables. Today, that ratio and that responsibility fall almost at 99% on the vulnerable people. If you know yourself, you're vulnerable. If you know yourself, you have diabetes. If you are of old age, if you have COPD, if you have lung disease, heart disease, or any kind of disease that you worry about yourself, then it is your responsibility to protect yourself, to avoid crowds, to put a mask on, and don't get into places where you pose an undue risk on you. We know about the virus. We know about your vulnerability. You are responsible for yourself. That people of young age, they can respect and not expose their loved ones that are vulnerable, but they need to go on with their life. And with this, I conclude that the question that comes, is the pandemic over? And the answer is absolutely not. It is a totally different nature pandemic. It is, we have changed our behavior. The humans in our society have changed regarding their immunity. We have so many new therapies that are effective in reducing mortality and hospitalization. And last but not least, we are growing and reaching and getting close to herd immunity every day. So with this, I would say, you're 18 years old, go on and live your life. Keep in mind, you have to protect the vulnerable if you have them in your society or in your circle, your grandmother or your father, if they had any chemotherapy or some kind of cancer and so forth. But if you know you are vulnerable, the responsibility falls on you to take care of yourself, protect yourself, avoid crowds, keep your mask on. Wish you the best. Love you all. Greetings from the virtual nephrologist. And yes, I am Dr. Rafai, and I am a practicing physician. And this is my take, my opinion on whether the pandemic is over or not.
To learn more about kidney disease, visit us on the web at thevirtualnephrologist.com.